Hi, Nick. Thank you for your message. It's great to meet you virtually. My name is Hans Roach, and I am your Medtronic respiratory rep. Your time is valuable, and I really appreciate your gracious offer of 5 minutes of your time for me to explain the Nellcor story and more specifically OxyMax technology. You mentioned that you're new to University Hospital and you're most recently at the Kiani General, where they primarily use Masimo products. So I'm excited to share Nellcor pulse oximetry with you and the differences between Nellcor technology and the technology you're used to back at your at the Kiani General. So our technology is a lot different, Nick. It's cardiac based, and as you know, arterial blood has a pulse rate, and that's where we measure at the pulse rate. So we put the pulse in pulse oximetry. So Nick, when I say it's a cardiac based signal, I'm saying that Nellcor is measuring the pulse before giving you SpO2. We qualify the pulse before giving you SpO2. You're not going to have the false assurances that you may have been used to. So the true pleth signal can be found at the pulse rate, and this is much different and more accurate than the saturation-based pulse oximetry technology that you have used in the past. So, Nick, you had mentioned that you wanted to know a little bit more about OxyMax technology, and there's a huge advantage with OxyMax. The OxyMax sensor resides in the hub. The OxyMax has a digital chip that resides in the hub of the sensor, and this gives us digital calibration. So digital calibration equals better performance. The digital chip improves the sensor's accuracy and reliability. So the Nellcor pulse oximeter with OxyMax looks for consistency in the shape, the amplitude, and the frequency of the pulse. And our cardiac gated averaging will assure you that you'll have accurate SpO2. Nick, I can share with you independent studies that show you the superiority of Nellcor's OxyMax technology in the ICU, in the NICU, poorly perfused patients. Every second counts. So if speed to post is important to you, if accuracy is important to you, Nellcor with OxyMax is an obvious choice. Nick, getting back to poorly perfused patients, you asked what sensor I would recommend, and I feel your pain, and I've heard the stories too about Masimo sensors not picking up or giving you a false high number. Nick, the sensor that I'm about to show you is ideal for poorly perfused adults. The MAXFAST SpO2 forehead sensor is designed to give you fast and accurate measurements of SpO2. The sensors respond to changes in oxygenation as much as 3 minutes earlier than compared to sensors put on the finger. They're much more accurate too. So why the forehead? The circulation under the skin of the lower forehead, just above the eyebrow, is supplied by a branch of the internal carotid artery, the source of blood that gives the supply to the eyes and the brain. And this area is less susceptible to vasoconstriction, meaning that the forehead sensor can maintain longer signals and signals than on the sensor that's on the finger during poor perfusion. So, and the patient's head is much more stable, and the sensor readings are less prone to drop out. So the MAXFAST sensor, which I'm about to show you, has expanded low sat accuracy feature reading, which you can read the patient in a difficult condition. So this low sat accuracy has a plus or minus range of 3%, which is pretty amazing. It's not equaled by any other sensor or any other technology in the market. So I'm going to show you the sensor. This is the MAXFAST forehead SpO2 sensor, and we put it just above the eyebrow, the left eyebrow. And Nick, what we also do too, and this is a little bit difficult for you to do, is we put a headband on. And it helps, this headband serves a couple purposes. It helps prevent venous pulsation at the sensor site and also maintain sensor position. So I understand that to you, reliable technology is critical to help you provide the highest level of patient care. And MAXFAST offers accurate readings. It helps maintain proper sensor position. It detects SpO2 changes earlier than finger sensors. And I think you'll love it. I know you'll love it. So Nick, I look forward to meeting you in person. Is there a time that we can set up for a possibility of a discussion of a trial at University Hospital? Please feel free to reach out to me at any time. And congrats on your new position at University Hospital. I look forward to meeting you in person. Take care.